Hi, I'm Ray Sievert with Tracy Technologies, and today we're talking about MTF, Modulation Transfer Function. What is it? Well, I'll fall back on a definition from Dr. Warren Hill, who says MTF is the ability to transfer contrast from the image viewed to the image formed. How do you use it in iTrace, and frankly, why do you use it? Well, let's review a case and we'll talk about it, because it's actually an excellent way to screen out patients who should not get a multifocal or a premium lens because of their corneal aberrations. Let's take a look at the case we're using today. When you look at the DLI screen, we have the optics of the cornea, and they're not that good. You see a lot of astigmatism. It seems regular. It seems normal. You do see a big cataract here on the opacity, and you see a correspondingly low DLI. So this is a classic mature cataract. Their vision is bad. It's primarily this, but it's also the cornea. If you recall, this is cornea, this is internal, and this is total. The cornea is driving some of their bad vision. How much? Well, if you look at it quantitatively, it's 0.189 microns. What does that mean? Well, we just don't know. There's a whole lot of theories about how much corneal aberration is a problem. Let's take a look now at how people use the MTF screen. First, let's define it. If you're looking on this axis, this is 100% contrast. And if you look down here, this is ever increasing numbers of line pairs. Think of it as smaller and smaller writing. This would be billboards. This would be regular writing. Down here, you get in the area of small pill bottles that nobody can read. So what should your vision be? Well, we've given you an indication. This box at 40% at 10 cycles per degree is sort of the danger zone. When you think about a patient who's happy, they generally have their MTF curve above that box. So if their curve is in that box, they're generally not happy. So let's go back to thinking about whether or not this patient should have a multifocal. Clearly they have a lot of astigmatism, so you would want them to have a toric. One of the ways you can see how much improvement they get with a toric lens is you click on this icon with the glasses. And so once you take this lens out and you give them the best E you can, this is their daily vision without glasses. It's a lot due to astigmatism. If you correct the astigmatism, it doesn't completely clear it up. So let's go back and look at this MTF. And if you choose to use this as a screening tool, this would tell you best corrected, they're barely out of that box. Now, most MTF curves need to be much higher than that if the patient's going to do well with a low contrast multifocal in the eye. Most of these multifocals are not super high contrast lenses, so you have to start with a pretty high cornea to end up with a total vision that's pretty good. I hope that makes sense, but generally speaking, when you see that the patient best corrected is barely out of that box, they're not good enough in terms of corneal optics to justify putting a low contrast multifocal in their eye. I hope that makes sense. There's a lot to learn about the MTF, and certainly when you look at the iTrace, you can see an MTF for the cornea, for the internal, and for the total eye. And your goal is always to get the total eye where this curve is not in that box. I hope that makes sense. Thanks for listening, and that is how to use the MTF to screen for premium lenses.